This presentation is meant to help explain important information about the benefits, risks, side effects, and alternatives to inguinal hernia surgery to help you make an informed decision about whether to proceed with this operation. This process is known as informed consent. If after watching this video you still have questions regarding this surgery, please direct them to your doctor. By now you have already talked with your doctor about a possible hernia in your groin area, also known as an inguinal hernia. A hernia is an opening in the muscles that make up the walls of your groin. This opening can allow fat, intra-abdominal organs such as intestines, or both, to stick out and cause a bulge. Occasionally, a hernia can be painful or cause discomfort, but often they have no symptoms at all. In addition to pain or discomfort, a hernia can become incarcerated, which means the contents of the hernia can get stuck in the opening. This is potentially dangerous as incarceration can lead to strangulation of the hernia contents. When a hernia strangulates, the blood supply to the entrapped contents is cut off. If bowel becomes entrapped in a hernia, it can also become obstructed or blocked. These can be dangerous complications and may require urgent surgery. Your doctor may have recommended repair of your hernia. Almost always a mesh or patch is used for this repair. There are several techniques used for this. Your doctor will be able to discuss these techniques and recommend which might be the best for you. This procedure is done in an operating room and often requires general anesthesia. Occasionally, this can be done under regional anesthesia, such as a spinal block. Though the length of the procedure varies based on patient body size, previous surgery, and the size of the hernia, most operations take less than 1 hour. In addition to your surgeon, an anesthesia provider, a surgical assistant, and several nurses and technicians will be present in the operating room. After your procedure, you will be moved to a recovery room where you'll be monitored closely. Most patients can go home safely the same day as their surgery, but some may need to spend the night in a hospital. The main potential benefit of hernia repair is to decrease the risk of incarceration, strangulation, and obstruction. While surgical repair can decrease or eliminate pain associated with the hernia, there are many other conditions that can cause this type of pain. Therefore, you may not experience complete resolution of pain. Over time, hernias can become bigger, making surgical repair more difficult. Repair of your hernia as early as possible before it progresses may prevent a more difficult and longer operation in the future. Repair may also improve the appearance of the hernia area. While surgery is often an effective treatment for inguinal hernia, not all conditions or problems in the groin can be diagnosed and treated with hernia repair surgery. Hernia surgery, like all procedures, has known risks. To make an informed decision about whether or not to proceed, you should understand what these risks are. Although all potential risks cannot be presented here, the most common will be. One of the most important complications of hernia repair is recurrence of the hernia. Though hernias can come back at any time after a repair, the highest risk is in the first 6 weeks after surgery. Your surgeon will discuss ways to decrease these risks. The risk of recurrent hernia is increased in obese patients, smokers, patients with chronic constipation, and patients having a repair of a recurrent hernia. Rarely, patients develop chronic pain after the operation. This can occur in the groin, the leg, or at the incision sites. Men may experience pain in the testicle. Patients with preoperative pain are at highest risk for post-operative chronic pain. This sometimes indicates the hernia may not have caused the preoperative symptoms. Often pain will improve over time. Treatment is usually anti-inflammatory medication such as ibuprofen and observation. In men, a risk of injuring the blood supply to and from the testicle is possible during this operation. This can result in testicular atrophy or shrinkage on the site of the surgery. Sometimes testicle removal may be required. Only one testicle is required for normal function. In men, injury or inflammation of a structure called the vas deferens, which carries sperm from the testicle, can result in impaired fertility. Structures surrounding the area of surgery, such as the bladder, bowel, and major blood vessels to the leg, can be injured during this operation. Such injury may require repair and possibly enlarging or changing the incision. Also, post-operative function of these structures could be impaired. For safety reasons during the operation, your surgeon may need to change the surgical approach by changing or enlarging the incision. This happens rarely because of an unexpected finding during surgery. Occasionally, a fluid collection known as a seroma may occur at the previous site of the hernia. This is usually inconsequential and resolves slowly over time. Very rarely, adhesions can form in the abdomen. The consequences are usually minimal. However, they may affect future surgery and can, on very rare occasions, impair bowel function. Although significant bleeding is rare, minor bleeding and bruising can be common. This can result in a collection of blood called a hematoma, which usually goes away on its own. Occasionally, bleeding can result in hospitalization, transfusion, and even a return to the operating room to control ongoing bleeding. Infections can occur in the incision or around the mesh patch used for the repair. Minor infections can usually be treated with antibiotics, partial opening of the incision, or both. However, if the mesh becomes infected, a return to the operating room for evaluation and mesh removal may be required. To prevent the rare occurrence of surgery at the wrong site, operating room staff have you mark the location of the hernia with a permanent marker. Although many of these risks and potential complications are rare and easily managed, when they occur, they can require extra treatment, both medical and surgical, and can change and prolong your recovery plan significantly. These risks and potential complications cannot be predicted or prevented by your surgeon. Many hernia operations are performed with the assistance of general anesthesia, which renders you unconscious and insensitive to pain or other stimuli. Although general anesthesia is quite safe, it does have risks associated with it. These risks can include, but are not limited to, damage to vital organs such as the brain and heart, cardiac arrest, death, recall or memory of the surgery, memory loss, awakening during surgery, an allergic or adverse reaction to the medications used during surgery and your anesthesia, injury to the lips, teeth, throat, vocal cords or voice box, lungs or extremities and nerves, sore throat, nausea and vomiting, incomplete pain control or the need for hospitalization. Some of these risks are quite rare, while other lesser risks can be more common. Your anesthesia provider at the Everett Clinic is an expert in the administration of ambulatory anesthesia and remains with you the entire time and sees you safely to the recovery room. We utilize the most up-to-date, short-acting medicines available, so you wake up quickly and are usually able to go home comfortably an hour or two following your procedure. Long-term side effects of inguinal hernia repair are rare. Occasionally, patients will notice a sense of fullness in the groin. There may be swelling and there may be a change in the appearance of the groin from the surgical scar. In men, there may be a change in the ability of the testicle to move. Some patients have post-operative constipation, which is temporary and treated with stool softeners. Often, pain from incisions may require use of pain medicine for several days. All alternative forms of treatment have their own potential risks, benefits, and side effects. One alternative to surgery is observation with the understanding the hernia will not go away on its own. Some patients report improved comfort with a compression binder worn over the hernia, but this does not cure it. Please understand that without treatment, the hernia may increase in size, incarcerate, strangulate, or cause an obstruction. For most patients with a hernia, surgical repair is the best choice. Recovery can vary depending on the approach used by your surgeon, the size and exact location of the hernia, whether the hernia is recurrent, and various patient characteristics such as obesity and tobacco use. In general, hernia repair is often completed as outpatient surgery. You will have some pain and swelling associated with your incisions. Most patients use pain medicine prescribed by their doctor for several days. You may also have some minor nausea and constipation. Your doctor will make specific recommendations about limiting certain activities, but most patients can return to normal activity within 2 to 6 weeks. If a complication occurs with your surgery, you will likely experience a longer recovery period. This presentation of the risks, benefits, side effects, and alternatives to inguinal hernia surgery is meant to help you make an informed decision about potential hernia repair. No surgeon can foresee all possible conditions and situations that might result in a complication or need for further treatment. Nor can any surgeon completely predict or prevent all the possible risks of this procedure. Therefore, this presentation is not meant to be complete, but rather provide an outline of the most significant implications of this surgery. If you have any further questions, please direct them to your doctor. Thank you for watching.